Good morning, everybody. Welcome to our Sickle Cell Anemia Awareness SF Advocacy and Empowerment Program. Today will be our fifth and final presentation of the 2026 season. Bless you very much. Today is Saturday, August 15th. We will be 2026. We are here presenting over at the beautiful facility known as the South Beach Harbor facility. Thank you very much for that. Today we'll be talking about the importance of hydration and kidney health, as well as the consequences of iron overload. That will be presented by the very famous, the very skilled, and the very educated Dr. Bukari, which we will get into in a little bit. So, once again, welcome to the fifth and final mini AEP of the 2026 season. Before we get started, we're going to do a short exercise to bring us all together as one in this place and time. So, if you can go ahead and we're going to do the moment to arrive, everybody. So, if you can take a deep breath and exhale, center your feet on the ground, hands at your sides or on your laps, or if in your beds. Make sure that your legs are completely extended out. Welcome, welcome. Come on in, come on in. So hands at your side, completely lay down on your backs if you're in your beds. If you are at your table, again, center your feet onto the ground. Make sure that your feet are grounded. We're going to take another deep breath. As we take this deep breath, we're going to close our eyes. So together now, let's take a deep breath. Close our eyes. Again, imagine everything that went wrong this week as you're taking that breath in. All the negative energy, all the bad stuff, the bad vibes. Let that percolate in your stomach and your lungs for a little bit as you feel that air. And now we're going to take a deep breath out, keeping our eyes closed. Breathe out. Let all that negative stuff flow out of you. Let all the things that didn't happen, that didn't go well, the could have, the what ifs, completely out of your system. Now we're going to take another deep breath. Again, closing our eyes. Take another deep breath. Inhale. Think about the positives of today, the positives of tomorrow, the things that can be, the things that will be, all your plans hopefully coming to fruition as you take that deep breath. And exhale. Open your eyes as you exhale, ready to learn, ready to go. All the negatives are out. You are a blank canvas, ready to learn. Welcome to our event today. As we take this moment in time to appreciate the efforts of all the group, let's round of applause for Nadina and the SCAA staff for putting this together. Round of applause for yourself for making it out here. It's definitely a trek on a Saturday morning, so we appreciate you and we love you for that. Couple announcements. If you are hungry, there is pizza off to the left. So if you would like to go ahead and serve yourself some pizza, we got chicken wings as well. And then there's a vending machine with various liquid options if you would like some. There's Monster Energy if you need a little pick-me-up. There's water if you need some hydration. And then there's various soda options that you may have. So it is cash only, so FYI. But the vending machines, just as an option for you. Again, another announcement is this is in lieu of our big fundraising event that we do every year, the second Saturday of September. This year will be September 12th over at the Opera House, Bayview Opera House. And we will start at 10 a.m., so hopefully we can see all of you there. We will have tons of raffles. I just got a connection from the Giants who are partially sponsoring the event by offering 2 tickets to the San Francisco Giants-Dodgers game in Section 125, which is literally right on top of the field. So if you guys are baseball fans, come on, buy yourself a raffle ticket, and hopefully you can win some Giants tickets. That's our latest. We'll also be raffling off basketball jerseys, which you can find on our website. You'll see which jerseys will be raffling off with the value of $150 per jersey. So some good stuff this year in our raffle. So hopefully that'll draw a lot of people to us. Again, tell your friends, tell your family, tell your cousin's cousin to come on out. It's always a good time at the KMJ Health and Fitness Expo and Walk. In terms of housekeeping, let's make sure we turn our cell phones off or put them into vibrate. We don't want to have any noises interrupt the presentation as we go along. If you need to use the bathroom at any time, please walk around the presentation. So you go through the outside and then work your way out. If you need the code to the bathroom, you can talk to our usher, Kayla, outside. She has the code to that. Any other questions you may have, please feel free to ask me. I am your host today, Kimball Torres. I am the Director of Development for SCAASF. Or you can feel free to ask Nadina, our CEO and founder, or any one of the SCA staff on board today. All media, presentation, videotaping, and pictures are done by our great crew, which today includes Faith and Kristen and How. So, any pictures that you want or want to get some pictures from them, just let them know. They'll forward that to you guys as well. And those of you online, thank you for joining us as well. You will get a recorded copy of this presentation as well sent to you after the presentation is done. And I think that's it for housekeeping rules. We will also, for those of you online, you'll be muted unless you have a question. And we choose you to ask that question, at which point in time we will unmute you and let you ask your question. Or we also have a chat feature being operated by the lovely Jasmine today. She is our tech person. Give it up for Jazz. She's hobbled, but she's still here doing the work. She had a gruesome sports-related injury where she partially tore her Achilles, and she is still fighting the good fight as a good soldier does. So she will be handling the tech today. So if you have any questions, you can also type them up on the chat, and she will be more than happy to answer those questions. And moving right along, we will get into it. So our presenter today is one Dr. Mohammed Bukari. He is an MD assistant clinical professor at UCSF Fresno. He is part of the Department of Medicine, the Division of Hematology and Oncology. He's done his residency and fellowship in Wayne State University, which is in Detroit Medical Center Cancer Institute. He was chief fellow in 2026-2027 at the Wayne Institute, University of Detroit Medical Center. He's also board certified. He's a recipient of the 2021 Henry J. Kaiser Award for Excellence in Teaching in the Fresno Medical Education Program. He's also a member of the American Society of Clinical Oncology and the American Society of Hematology. He's also chairman of the Clinical Consensus Group, a community medical center. He's the director of Adult Ambulatory Sickle Cell Clinic, which is part of the UCSF Center for Inherited Blood Disorders Pacific Sickle Cell Regional Collaborative Program, and the Networking California for Sickle Cell Care. So he's the director of that. Dr. Bukari specializes in malignant hematology, such as leukemia, lymphoma, myeloproliferative disorders, and benign hematology, sickle cell, and thalassemia. He is investigator of many malignant hematology trials at UCSF Fresno. And one of his great hobbies includes soccer. So he was probably a little bit sad when the World Cup ended, as I was. So we all have a little bit World Cup haze. So hopefully he brought it together to give us a great presentation today. So without further ado, I present to you Dr. Bukari.
And acidosis, which means that when you have hypoxia and the body undergoes what we call glycolysis or Krebs cycle, there are acid products that are produced within the tissue microenvironment, and then increase hemoglobin S concentration, and then last but not the least, hydration. So hydration can cause increased hemoglobin S concentration, and this will increase the probability of the cells to sickle and blockage of small blood vessels through rigidity of the cell, increased adhesion and hemolysis. And the rigidity of the cells and adhesion will cause endothelial damage. Hemolysis will cause anemia. And then the endothelial damage will cause increased activation of coagulation, blood coagulation pathway, and inflammatory pathway. And this will eventually lead to what we call vaso-occlusion, and then sickle cell multi-organ tissue hypoxia and damage, which will lead to death. So you can see that hydration plays a key role in in causing increase in hemoglobin S concentration, or maintenance of good hydration will reduce the concentration of hemoglobin S. And so if you have good hydration, no increase in concentration of hemoglobin S, and for that matter, the cells are less likely to sickle, they are less likely to be rigid, and there is less likelihood of inducing adhesion of the cells and hemolysis. Now, we already know all the therapeutic therapy available for sickle cell disease, hydroxyurea. Now, voxelotor is no longer on the market. There's a gene therapy which will modulate the gene, and all of them are designed to either block the formation of hemoglobin S or reduce either the quantity of hemoglobin S or reduce the rigidity of cells that have hemoglobin S, or reduce the adhesion of cells that have hemoglobin S. And then there is crizanlizumab, which is hardly used nowadays, which will reduce adhesion of cells to the blood vessel. And then there is L-glutamine, which will reduce oxidative stress and therefore reduce hemolysis and hence sickling. So in terms of hydration of the cells, so how do the cells maintain hydration? The red part of the picture is normal red cell, where hydration is maintained through certain ion channels. There are three main ion channels on the cell surface membrane or transmembrane ion channels, which allows, for the purposes of this presentation, exchange of ions between intracellular and extracellular part of the red blood cell. So the intracellular part is the part that is within the cell. Extracellular part is pretty much plasma. So the exchange of these ions, if it is working normally, will lead to maintenance of the cell structure and maintenance of the biconcave cell structure. If for some reason, either because of low oxygen stress or other pathophysiologic mechanism of sickle cell disease, there is interference of this ion channel, the Gados channel, the P-sickle channel, and the KCC channel, the cells will tend to lose electrolyte to the extracellular part of the cell, especially the potassium ion. And this may be accompanied with loss of fluid to the extracellular part of the cell. And this will lead to either increased concentration of the hemoglobin S or deformity of the cell or both. And this will lead to sickling of the cell and hence blockage of the small capillaries or the arterioles, and this will lead to eventual sickling. So this means that maintenance of electrolyte balance between the outside of the cells and within the cell, which is associated with maintenance of hydration status of the cell, becomes very important in preventing the cells from being from becoming sickle cell. Moving forward, when we look at the kidney function, again, kidneys are also responsible for maintaining overall our body fluid and electrolyte balance. So the kidneys either concentrate urine or dilute urine depending on the fluid and electrolyte balance of an individual. Sickle cell, however, has a direct impact on the kidney function, where, let's say, if you take somebody with sickle cell, if they have intravascular hemolysis where the cells are breaking down, they release chemicals. Some of them include the hemin chemical, the iron chemical, or even the hemoglobin, which may damage the kidney and therefore impact the ability of the kidney to maintain good hydration status of an individual. So we know that as time goes on in sickle cell disease, some people may have bloody urine, they may have protein in their urine, they may lose their ability to concentrate urine. Therefore, if you cannot concentrate urine, what it means is that you cannot maintain your hydration status. Therefore, you tend to lose a lot more fluid compared to somebody who doesn't have sickle cell disease. And as time goes on, the glomeruli, which is the blood vessel within the kidney, which is responsible for maintaining normal kidney function, also becomes damaged. And as time goes on, the kidneys are damaged to the point of irreversibility and leading to somebody needing either what we call renal supplementation, including dialysis. So when we look at the other screen, which shows that even as an infant, early kidney damage can be detected in sickle cell patients. For instance, early kidney damage may lead to what we call hyperfiltration. Hyperfiltration means the glomeruli, which is the blood vessel within the kidney that is responsible for filtration, when it is damaged, it's not able to filter some of the proteins and the electrolytes that you need from going into the collecting system. And when that happens, you can lose essential electrolyte, including sodium, potassium, and some protein. And the kidney will eventually have inability to concentrate urine. And this can manifest as frequent urination, especially at night, and therefore is one of the most common cause of bedwetting in infant and young children. In that situation, then the normal measure of kidney function called creatinine remain essentially normal, whilst the kidney's ability to filter out certain electrolytes and proteins are significantly impaired. And the kidney's also ability to also maintain fluid absorption from the urine in a dehydration state will also become impaired. Unfortunately, the management of sickle cell pain, especially using certain pain medication like non-steroidal anti-inflammatory drugs like Motrin or ibuprofen, Aleve or naproxen, may also add insult to the kidney and make the kidney not function or worsen the kidney function. When you look at adults with sickle cell disease, some of them will spill protein in the urine called macroalbuminuria, and their glomerular function may progressively get worse and eventually develop chronic kidney disease or end-stage renal failure requiring hemodialysis. So sickle cell disease itself affects the kidney, and when the kidney is affected, it also affects the sickle cell because of ability of the kidney to maintain good hydration, as well as retain some of the electrolytes that will help in preventing sickle cell crisis. So some people, as you get more and more kidney damage, you go into the cycle of sickle cell crisis or sickle cell complication causing kidney damage, and then kidneys are not able to absorb enough fluid or electrolyte, and then that will lead to sickle cell crisis, and then you just go into this cycle of sickle cell crisis, kidney damage, more sickle cell crisis will lead. So you go into this cycle until you get to a point where the kidneys are so damaged that the kidney is not able to function properly. And sometimes for sickle cell patient, additional thing that happens is the kidneys produce what we call erythropoietin, which is a growth factor for the red blood cell in the bone marrow. So normally, when somebody is anemic, the kidneys produce a lot of erythropoietin, and that will help the body to make more red blood cells. So when you have kidney damage, you are not able to produce that erythropoietin. So most patients becomes a lot more anemic than they were before, which is also a sign that your kidneys are being damaged. And in some individuals, they get to a point where they need erythropoietin injection to help at least maintain a balance between the amount of cells the body produces and the amount of cells the body is losing. Now, moving forward, I already mentioned this. So we have number one, which is sickle cell can reduce oxygen delivery to the kidney itself. And when this happens, the kidney becomes damaged. And then when the kidneys are damaged, the kidney loses its ability to concentrate urine. And then the third point is that you urinate more, therefore you become more dehydrated. And therefore, number one also happens again. And then the kidneys will also, or you develop more crisis. And more crisis means less delivery of oxygen to the kidney and direct kidney damage, and then kidney damage, and then inability to concentrate urine or inability to keep yourself hydrated. And then this 1, 2, 3 just keep repeating itself. And eventually you're going to get to a point where the kidney is far damaged that you're going to need to do something like dialysis. So, what impact does ensuring good hydration have on the body? So when the body is short in fluid, the main thing you see is your kidneys, your blood becomes more concentrated. And then the more concentrated your blood means the more concentrated your hemoglobin S. And then there is sickling, which is induced, which will lead to blockage of blood flow. And unfortunately, once you go into crisis, you also develop physiologic changes that will lead to loss of fluid. For instance, fever, vomiting, diarrhea, or reduced oral intake. And that also doesn't help. It makes you more dehydrated and it makes your blood more concentrated. And so it will just propagate, circling, and then keep things going in the wrong direction. So what can we do to prevent things from going in the wrong direction? First of all, keeping yourself hydrated in a steady state is very important by drinking enough to prevent you from becoming dehydrated. And this should be a conscious effort throughout the day. It's not just keeping yourself hydrated in the morning and end of story. You need to keep yourself hydrated throughout the day in order to maintain your fluid balance and reduce the impact of dehydration, because unfortunately, once you get dehydrated for even short period of time, you start sickle, and then sickling will lead to reduced renal flow, and reduced renal flow will lead to inability of the kidney to reabsorb the fluid, and then we'll just keep everything going until you are able to break the cycle of dehydration, reduced renal function, further dehydration by keeping yourself hydrated. The next thing you need to do is to pay attention to the color of urine. Majority of the people, when you become dehydrated, the urine will change color from the normal urine color to more concentrated urine, and I will show the picture in the next few slides. And the more concentrated urine you have, when the urine becomes darker or dark yellowish, if you don't recognize it and reverse it quickly, you get into trouble. The next point you need to, that will help you, is to have a personalized plan of keeping yourself hydrated. Personalized plan means you know that, okay, I'm going to go out, therefore I need some source of fluid, and it's not just enough, or it's not enough to carry a water bottle around. I always tell my patient, don't make it look fanciful by carrying water bottle around. You have to take the water. The water doesn't work well when it's in the bottle. It works when it's in the body. So you have to have conscious effort. You talk to your doctor, because your sickle cell doctor will know how your kidneys are doing, how much fluid your body can handle, and have a plan on, okay, if I need 2 liters of fluid every day, it has to be spread over the 12 hours or 24-hour period so that you keep yourself well balanced all the time. So, what is the fluid target for sickle cell patient? And I get this question all the time. There is no set target for any patient. You need to talk to your doctor because some patients with sickle cell disease who already have either heart or kidney damage, they may not be able to tolerate as much fluid as patients who do not have heart or kidney damage. Overall, when you are younger, hopefully you don't have kidney damage, you don't have cardiac heart disease, you are able to tolerate more liberal fluid plan. Even when patients are admitted to the hospital, I always tell some patients and some patients that, listen, when you go to the hospital, just let them know that they should not treat you like all the other sickle cell patients they know. Because if you already have congestive heart failure or your heart function is not good and your kidney function is not good, if they give you hydration just like any other sickle cell patient, more than likely you're going to end up with swollen hands and feet by the time you are ready to go home. And we have to use Lasix to get rid of the excess fluid that you're given. So there are some patients, I specifically tell them, listen, when you go in, tell them because of what has happened in the past, if they give you too much fluid, you're going to be volume overloaded. So if your target is 1,500 or 2,000 milliliters or 2 liters, let them know ahead of time that, listen, my doctor says you should be careful with the amount of fluid you are giving me. Don't give me too much fluid. And most patients, I tell them, if you can drink, just maintain oral hydration in the hospital so that they don't have to give you IV fluids whilst you are in the hospital. If for whatever reason you cannot tolerate oral intake, or you have diarrhea, nausea, or vomiting, then hydration, depending on your fluid status, matters. And then if you have fever, obviously you are going to have a lot of insensitive fluid losses. Therefore, it's imperative that they take that into account in your hydration when they are hydrating you. But overall, oral hydration is always preferred, especially in adults. In pediatrics, though, because of our inability to guarantee them to remember to take fluid and all that, and the fact that they are less likely going to have cardiac dysfunction or kidney dysfunction, we focus more on intravenous hydration compared to adult, where we are very careful with how much hydration we give somebody because of either pre-existing heart or kidney dysfunction. So overall, 2 to 3 liters for most adults should be the target. Some people may need a little less, some people may need a little more, depending on their clinical situation, and 2 to 3 liters in 24 hours. So one of the things that I advise my sickle cell patient, when you see your doctor, in addition to getting pain management plan, just get hydration plan, and they know your kidney function, they know if you have heart dysfunction or you have any other reason not to do aggressive hydration, so that you have a plan of how much you need. So hydration, to make it easier to remember, you start by drinking in the morning, and then, with your meals, and then carry water around, and then adapt extra break, especially if you are a working person. And I tell patients, during your break time, you need to incorporate hydration as part of your break routine. So let's say you're working and you don't have access to water, your water is in the locker. During the break, you need to incorporate and make an effort to incorporate keeping yourself hydrated as part of your break routine. So this is an example of urine color. that you should be aware of. There's very pale urine, and then yellow, and then you go to dark yellow, and then dark brown. You don't want to get to the point where you are dark brown because that's probably too late. So usually the pale yellow should be well hydrated urine. Okay. When you go to dark yellow or darker yellow, that means you are dehydrated. You don't want to get to dark yellow or brown because that's probably too late. As soon as you know your normal color, which is pale yellow, once it's darkened, you need to make an additional effort to keep yourself hydrated, increase your hydration status, and monitor closely your next urine to make sure that things are not going in the wrong direction. And then we talked about possible clue to kidney injury, which may be silent, sometimes urinating more often at night. For much older male, it may be a sign of prostate or kidney damage. But for younger people, it's something that you need to bring up with to the attention of your doctor. And for younger people, bedwetting beyond expected age for this condition should be a red flag that maybe there might be kidney damage, especially if you are a sickle cell patient. Foamy urine is also a silent sign of kidney damage you need to bring to the attention of your provider. Foamy urine means you are losing a lot of protein in the urine. And then blood in urine is always a sign of something not right in not just the urine, but not just the kidney, but the kidney collecting system and the bladder. So all these clues should be brought to the attention to your sickle cell provider or your hematologist, so that they can look into it further. What are the possible later clues? Swelling around the eyes, feet, and ankle. And for me, I see this a lot in patients, especially when you get admitted. If you're a sickle cell patient and anytime you get admitted, you easily develop swollen hands and feet with hydration. That means you need to bring it to the attention of your sickle cell provider, because sometimes you get admitted in a hospital where the provider doesn't go directly. They have another team in the hospital who take care of you, and when you get released from the hospital, you see your provider, but you need to bring to their attention that, hey, the last time I went to the hospital, when they gave me hydration, by the time I got out, my eyes or areas around my eyes were swollen, my feet were very swollen, or my ankles were very swollen, and it took several weeks for it to return to where it used to be. When you have rising blood pressure, you also need to bring to the attention of your provider unusual fatigue, nausea, poor appetite. This is a non-specific sign. It may be a sign of anemia, but it's also something that you need to bring to your attention of your doctor. Less urine production and shortness of breath. Make sure you bring this to the attention of your sickle cell provider. What can the provider or the sickle cell doctors do as part of your routine? Once a year, at least once a year, they need to check your urine for albumin or protein and document it. And if needed, if they see early spillage of albumin or protein in your urine, you need to be referred to the kidney specialist, who will evaluate you further and see if they can start you on medication to reduce your kidney spilling protein or urine. And then this is generally done routinely with blood work, eGFR, and creatinine. In sickle cell patients, this is not the best test to measure kidney function because of the fact that some patients will have normal eGFR and creatinine and still be wasting protein and electrolyte in the urine. But combination of eGFR and creatinine and then urine protein creatinine ratio can be used as a good estimation of how good your kidneys are doing. And this can be a marker of how good your sickle cell is doing. just to give you an example, I have a young patient, 24-year-old college student, who otherwise has maybe no crisis in the last 2 to 3 years. And then we had a urine protein creatinine ratio. It showed significant protein loss in the urine. And then the creatinine looks okay, but the fact that he has significant protein loss in the urine means that, yes, overall, he's not having a lot of bone crisis or bone pain or other organ complication, but the sickle cell is damaging his kidney. So that tells me that his sickle cell is not doing as good as he thought he was doing. And then to protect your kidney beyond hydration, you need to keep your sickle cell visit and labs. Check your blood pressure regularly, take prescribed disease-modifying medication, and review all your supplements. And I know some people believe in supplements, but make sure you review all your supplements with your doctor and avoid taking non-steroidal anti-inflammatory drugs without your doctor's knowledge, like Aleve, naproxen, ibuprofen, all the non-toradol. Just don't take it without the knowledge of your sickle cell provider. And then in terms of pain medication, I just summarized this. All the non-steroidal anti-inflammatory drugs will have negative impact on the kidney, especially during sickle cell crisis when you are dehydrated. So please, especially in adults, we are very cautious with use of these medications. And when I see patient first, it's one of the things that I review with the patient to make sure they understand that, taking non-steroidal anti-inflammatory drug, especially during sickle cell crisis, may be detrimental. And then ask which pain medication dose and duration are safest for you. And then do not stop prescribed medication without discussing with your sickle cell provider. So during illness and dehydration, during acute illness, including sickle cell crisis, dehydration can happen quickly. So if you notice fever, diarrhea, poor oral intake, heat exposure, follow your day-to-day sickle cell plan and contact your doctor. Seek urgent help if you notice blood in the urine, especially, because that can be a sign of bad things happening. Know the signs that help, needs urgent attention is very important. Fever, trouble breathing, severe pain, especially flank pain, nausea, vomiting, inability to drink, too little urine, excessive swelling, especially around the eyes and lower extremity, and then blood in the urine. I can't emphasize enough, blood in the urine is a danger sign. I know that for females, sometimes this may be difficult to differentiate from menstrual bleeding, but if you are not in your menstrual cycle and you see blood in the urine, very important to bring to the attention. Even if it's a one-time blood, you need to bring to the attention of your doctors or go to urgent care for evaluation. Build your personal kidney protection plan. What is my daily fluid goal? When you meet your doctor, these are the questions that you could ask to help have your personalized daily kidney protection plan. What is my fluid, or what is my daily fluid goal? Do I need to limit my fluid? Remember, I mentioned, especially in adult, sickle cell adult, we have to balance the fluid intake with heart function and kidney function. So that's why you need to ask this question. When were my urine protein and kidney function last checked? Also, it's important, I always say empower patient. I prefer to see empowered patient than patient who expect me to remember to do everything for them. If you ask me if I haven't done it, that will remind me that, hey, we haven't checked your urine protein creatinine this year. Let's get it done. we haven't checked my vitamin D this year. Let's get it done. Hey, it looks like I haven't checked any of my my vitamins, zinc, copper, folic acid, B12. Can we have it checked once a year so that I can optimize my hematopoiesis? And then what pain medication should I avoid? I think we talk about this all the time, but um, every now and then, if you ask your doctor, they will help you. And if you are buying anything over the counter, I'm not saying supplement is not good. Always check with your doctor. Hey, I have this supplement that a family member recommend that is very good for sickle cell patient. Is it appropriate for me? Because what is good for other people may not be appropriate for you. And then what is my sick day and emergency plan? Again, if I have a patient who has sickle cell disease and they have congestive heart failure or kidney failure as well, I always tell them, when you go to the hospital, make sure they are aware that because of my kidney or my heart, don't my doctor says that too much fluid is not good for me. And once you mention that, they have to think twice on how much fluid they're going to give you. Obviously, I can't tell you this amount or that amount. The person who is seeing you will make that determination. They will look at your blood pressure, your heart rate, your clinical exam, your electrolyte, your kidney function, your heart function to determine and whether you are losing a lot of fluid during that crisis or you are not drinking enough fluid, whether you have diarrhea, nausea, vomiting. All that should play a part into deciding how much fluid you need and over what period. So these are, if there is one slide that I want to leave you, or two slides actually. The first one is know the signs and symptoms that need urgent help. That's slide number 1. Slide number 2, build your personal kidney protection plan, your daily fluid goal, your fluid, if you need a fluid limit, whether your kidney function has been checked regularly at least once a year, most of the time, twice a year or 3 times a year if it was abnormal before, and then which pain medications to avoid, and what are my sick day or emergency plan. Drink steadily, screen early, and act quickly. So this is the end.
Great presentation, Dr. Good job. We'll take a quick little 5-minute pause before so everybody can gather their thoughts. Some questions that you may have, write them down. We'll just take these 5 minutes really quickly to just kind of let all the information sink in, and then we'll come back with Dr. Bukari for Q&A for the last 15 minutes. And any other questions people may have in general. So let's take a quick 5-minute break. Again, if you guys want to get pizza or take the time to please go ahead and take that opportunity. We'll be back in 5 minutes, Dr. Bukari, with questions.
Okay, and I think let me just address 2 questions that were posted. We go on break.
Can you repeat that?
I think Nad posted 2 questions. I wanted to address them. There's a question from Madeline. So the first question is, what is the state for person to go from hydration status? That's why first of all, you have to look at the current temperature.
Excuse me, if someone has their volume or the audio or muted and it's reverbing like an echo.
So think about it this way. If we are in the middle of summer in Fresno, you know that dehydration will be very common, okay? Because the weather is very hot and you're likely going to lose a lot of fluid. So paying attention to hydration will become very paramount. But in winter in Michigan, you could easily become overhydrated when you take too much fluid. For instance, if it's in the middle of winter and if you are advised to take 3 to 4 liters a day, and then you keep taking 3 to 4 liters a day, there's a good chance that you may be overhydrated. And this can be seen in puffiness around the eyes, swelling in the lower extremity, and your urine becomes really, really dilute, and you are peeing, you are urinating maybe every 1 hour, every 2 hours, and a lot of urine. So for hydration management, it is not one cup fit all. That is why it's important, just like we say the pain management is not one cup fit all, hydration management is similarly not one cup fit all. You have to discuss with your doctor. They have to take into account your overall sickle cell situation and your clinical situation, the weather situation, and then your kidney and your cardiac function. And I think Marilyn asked the same question. Yes, fluid restriction may be good for somebody with cardiac or renal function or combination of cardiac and renal function, but we have to balance that with keeping them hydrated if they have sickle cell disease. So it's a fine balance that you and your doctor will have to come to an agreement as to what amount is appropriate for you. So the message from me for this presentation is just like we have pain management plan with your hematologist or sickle cell provider, the same way you should have some kind of hydration plan. And that will really help you maneuver through all the weather changes. In Fresno, I tell people, it is very easy to assume that the outside is hot, and so the inside is also going to be hot. I have seen situations where most common reason patients have crisis is they were going out, outside is hot, so they were lightly dressed. And then they go into a supermarket and they go into the freezer compartment. And then by the time they are out, they are like, oh my God, this is like crazy. So you have to be intentional. When you're going somewhere, you have to be intentional about what you need. If you're going somewhere, the weather is hot, but you suspect you're going to be sitting in a conference room for a conference, you need to be prepared that, hey, the conference room might be cold. So let me take my jacket so I can keep warm in the conference room. And then when I'm going out, I'll take off my jacket so I don't get, too hot. So I tell people that, sickle cell is an expensive disease and you have to be intentional about your lifestyle. Anytime you're going somewhere, you just cannot take follow your friends. Young people, that's where they get trapped. Your friend comes and then you just get out and follow your friend. And then things crop up on you and then you are not prepared. So my recommendation always is be mindful of where you're going, where you're likely to end up, and be prepared for any changes in either the weather condition or whatever situation you are in. Thank you.
Thank you for answering those questions. Like Kimball said, we're gonna take a break and we'll come back with the more questions. There are people here in person that probably have more questions for you, Dr. Bukari. So we'll take a quick break and gather our thoughts for that.
Thank you. And the slides are available. I created them with the help of online platforms, just to make it easy to comprehend. I know this is for patients, and the references are also attached just in case for those who are curious and they want to read more. And, they are attached.
Thank you. So we'll be back in about 5 minutes.
Thank you.
Thank you.
Welcome back. Our last segment of the afternoon, the precious Q&A. If anybody has any questions, please feel free to ask at this moment. Anybody got any questions?
So,
Presentation.
We were fielding it online.
yeah.
There
So
were two questions from Faith. In your opinion, how often should sickle cell patients have their electrolytes done? And then we'll field the second question after you answer that one.
So, it depends on the patient. For most patients who require visit at least quarterly, with each visit, getting your electrolyte check is reasonable. I do have some patients who see me once every 6 months, and at each visit, I get the electrolyte checked. But by and large, when there is an acute episode, like when you went to the you go to the hospital for admission for sickle cell or anything changes, then yes, it needs to be done. So the short answer is it depends on the patient, but by and large, with each visit is what I will say.
Thank you.
And then for the urine kidney, urine protein creatinine ratio, at least once a year.
Thank you. And for the second question, what is your recommendation of the best electrolyte drinks that do help with hydration, like Gatorade or Liquid IV, etc.?
Yes, so thank you very much. This is a question that I get asked all the time. So again, this is where my knowledge of your sickle cell comes into play. Probably the simplest of the answer is water. Okay. But, if somebody has good renal function and good cardiac function, maybe electrolyte might help keep you electrolyte drink might help keep you hydrated. But if your kidney function is not the best and you have cardiac dysfunction or your ability and sometimes the kidney may be working, the creatinine may be okay, but the kidney is not able to handle electrolyte load very well, then I will not recommend, electrolyte solution because that just increase the electrolyte load on the kidney. Yeah, so that's, again, this will be very good if your doctor knows your overall medical condition. They know your cardiac function, they know your kidney function, they know your electrolyte function, and then they can recommend whether Gatorade is good. But overall, water, most people are able to handle appropriate amount of water well. And appropriate is the key.
Any other questions from anybody in the crowd? Dr. Bukari, how would a kidney stone incident affect the hydration of somebody who has sickle cell disease?
Yes, so, for somebody with sickle cell disease, I think when they develop kidney stone, sometimes it's good for the stone to be evaluated to see the component of the stone, and then the sickle cell doctor can work with the urologist to come up with fluid intake plan. But overall, if your kidney is working well and your cardiac function is good, keeping yourself well hydrated will help reduce the incidence of kidney stone. And
you have a question in the back.
And then additional adjustment of hydration and what type of hydration can be done based on the composition of your kidney stone.
Okay, that's good to know. Thank you, Dr. Bukari. We have a question in the back for you, doctor.
You can hear me from here.
Yeah.
So,
We have another question. We just want to know if you can hear them in the back.
No. Maybe you can just repeat the question. I think I can hear you well.
Hi, my name is Petrukwi Lorata. I'm from Cameroon, but I'm studying at UC Berkeley School of Journalism. Before I came to Berkeley, I kind of spent my whole life in Cameroon, and sickle cell is such a big thing back home. But then when I came here, I realized that a lot of people do not know about sickle cell, although there are people in America that have the disease too. So my question is, what do you think people like yourself, organizations, and even individuals with sickle cell can do to kind of create awareness about sickle cell? And yeah, that's my question.
Once again, thank you for attending. We appreciate everything that you've done for us and your attendance as well. If you have any questions or further want further explanation on anything, you can contact Dr. Bukari. You can reach us to contact Dr. Bukari, or if there's a way that he showed us to contact him, you can go ahead and use those means. Once again, I am the host, Kimball Torres, Director of Development for SCAASF. From Nadina, our CEO, and the rest of us at SCAASF, we thank you for your participation and time. Once again, Dr. Bukari, great presentation. We appreciate you. We love you all. Make sure you stay safe. And again, if you want to make a change, you got to be the change. Go out there and be proactive. You got to do stuff in order to get any type of result. If you sit around and wait, nothing will ever happen. Those of us that try will always get help from everybody and anybody and the great person above. So have a wonderful day. Bless you all. This is Kimball Torres signing off. See you later.
Thank you so much, and thank you all for your time. Just like Torres says, we really appreciate it. We had several virtual people in this particular session, which was good. And I'm just thankful that all of you all were able to come and be a part of it. And yeah, this is our last one for the year. And yeah, everybody have a good rest of your day.
Awesome.